So, and I'm also very nervous because in our audience today is probably one of the most renowned experts in mental health care, Dr. Hazli Zakaria. So what I hope is that all of you think about what I'm going to share, and I look forward to really challenging questions at the end of this session. So, guys, if I can have my slides. Whoa. I think the matrix is taking over. Let me know when you have it up. So my first question, when you think about mental health care, what is the biggest challenge we have in Malaysia and around the world till today when it comes to mental health? Lack of awareness. Stigma, okay. Good point. All good? So today, just to kind of whet your appetites, I'm going to talk about the equivalent of continuous glucose monitoring for mental health. How's that sound? So thanks for sharing the big challenge. You're right in the sense that awareness, stigma and issues, people are not reaching out for help even though they need help. Now, how do we do that? Well, a lot of times we use simple screening tools. And one of them that's quite common is the DAS-21 assessment. So just to get going, just for you to feel and know what this experience is, can I get you to either scan this QR code, and if it's not clear, there's also another QR code right at the back, or if you cannot somehow scan, you can just go on your browser and type the naluri.link/mental health. So it's a simple 21 question. It should take you about 3 to 5 minutes to complete. Just do a little check-in, how you're feeling over this past week. Now, while you do that, I also have to preface by saying all the credit for what I'm going to be sharing with you today is the work of two of my co-founders and colleagues, Dr. Jeremy Ting and Dr. Tiffany Ong. So this is their baby. I'm here to just kind of give you a little taste or exposure of the work that they've been working on for the last 5 years. You know, scan, check in, see how you're doing. Early Sunday morning, it's a weekend. Part of this exercise is I want you to kind of feel what it takes to complete one of these simple assessments. It's a simple screening tool. It's not a diagnosis, but it just gives an indication of how you're feeling.
Every day, over 1,300 children under the age of 5 die from diseases caused by unsafe drinking water, poor sanitation, and hygiene. No child should die from lack of clean and safe water. But with your support, we can save children with one simple solution. Water purification.
We gotta keep the fire burning. Come together, bring the passion alive. And if we feel the world stop turning, we gon' find a way to.
About 60% normal, but 40% have elevated levels of depression at different degrees of severity of intensity. Most at the kind of early, mild, moderate stage. Anxiety seems to be a bigger theme topic. almost 60% have some levels of anxiety, and again, most at that early, mild, moderate stage, and about 30% are kind of going through a little bit of a stressful episode this past week. Now, we use this assessment, everyone around the world has been using this, and it's very interesting with the data sets. We have probably about 500,000 of these data sets. Here's an example of an analysis by cutting it by age group. Unsurprisingly, as you can see, the Gen Zs under 30 typically have double the rates of those above 40, above 50. There's clearly a generational gap. You can cut it by gender. Here's an example of an analysis that we've done for an organization, where you can cut it by group functions to understand where are some of the hot spots typically in an organization. And of course, it becomes more valuable when you can see it over time, a longitudinal perspective, right? And this is an example of that by job group, but 2021, 2022, 2023, what has changed? The good news, 2023 is the first time that we've seen a slight dip across all of Southeast Asia compared to the spikes that we saw in 2021. It was still quite high in 2022. And by October this year, in conjunction with World Mental Health Day, we'll be doing another massive campaign. We'll probably get another 100,000 respondents to this to kind of see whether the trends are, whether we're going to kind of see it come back down again in 2024. Now, DAS21 is not a diagnosis, as Dr. Hazli will remind all of us, but it has very strong statistical correlations with a proper diagnosis. So typically, in a lot of organizations, we would come in and we conduct a massive drive. As you can see just now, some of the largest organizations in Malaysia, they've been doing this for 3 years, 5 years, by all the business groups, because you want to proactively find who may have early health risks. Because as someone shared earlier, one of the challenges is awareness. I don't know what I'm going through. So kind of assessments like this help us find people and then proactively reach out to them, especially when they're at that yellow amber stage, instead of waiting for them to get to that red stage where it's severe, it's already crippling their ability at work. Now, because it's just a screening tool, it's just step one. Because you can start engaging with them earlier, you can bring them in. A proper psychologist, for example, would be able to conduct a proper assessment, diagnosis, really getting into the granularity of the questions you answered. What were some potential triggers? How has it affected your ability to perform at work? How has it been over the past 1 week, 2 weeks? Is this a recurring thing? To really be able to come up with a proper diagnosis of whether this is a clinical level of depression, anxiety, or chronic stress. But as all of you can imagine, before that, what's also interesting is we can then start to measure people who receive treatment, coaching, counseling. Over time, let's say over 4 to 6 months, you can start to see noticeable and quantitative improvements. For example, people who we proactively reach out, about 50% of them see elevated improvements in their depression, 54% improve their stress levels. But the challenge, if you've all gone through, is it's not that easy to complete this 21 question assessment, right? And imagine if I had to try to take a snapshot of it every week or every month. You can imagine a lot of people, for us to get that second DAS21, it's a lot of work reaching out to them, reminding, hey, please complete your assessment, please complete your assessment. So it takes a long time. Imagine that this assessment that you've completed is the equivalent of measuring your glucose using a glucometer. It's a single snapshot. Your feelings might change tomorrow or next week, right? So it's not great in terms of capturing overall ongoing, how is your mental health? So if this DAS21 assessment is a glucometer, what would be the equivalent of a continuous glucose monitoring tool for mental health. One where we can measure and assess the state of someone's mental health quantitatively over each day, week, and month. So that when we know when someone's potentially going through a distressing episode, we can then proactively reach out to them. And that's what we've been building. We've been building what we call our HOPE AI, the continuous glucose monitoring for mental health. So what this is, essentially, is diving deep into text-based chat. Because what we find, as we work mainly with employees in the corporations that we serve, 87% of the counseling and coaching that we do is via text-based chat. People prefer this a lot more than having to make a one-on-one appointment and speak to a counselor or psychologist. It's a lot more convenient. So what we do, obviously there's a Naluri app, there's a Naluri web version, we've created a WhatsApp version, and in particular, the younger generation under 35, they definitely prefer text-based chat to having to meet and talk to a live person, either video or in person. That still happens about 13% of the time, but most of the conversation is text-based chat. This creates a very significant opportunity. So what we've done is we've built an AI algorithm that continuously quantifies emotional sentiment based on text-based conversations. And with 5 years of data, about 250,000 text-based conversations, we're now able to get it to the point where it's actually a pretty good, robust correlation with DAS-21 assessments. So which means we no longer have to chase people to say, hey, please complete that 21 question assessment because we need your depression score, your anxiety score, your stress score, but in just your regular text-based chat. And we're now, by the way, integrating this with Microsoft Teams. So it becomes regular text-based conversations allow us to effectively get the equivalent score. Right? And as you can see, with a very, very low p-value, an area under curve measurement where in English it's the highest so far at 0.92, which I think is a pretty robust correlation. Bahasa Malaysia at about 0.88, Bahasa Indonesia 0.83, which I think means it's ready to be kind of commercially launched. Thai and Chinese, we do not have enough of the data sets to be able to get it to be meaningfully correlated. But these are because we just, we need to continue to recruit more of conversations in those languages. But with English, Bahasa Malaysia, Bahasa Indonesia, it's now getting to be a really, really good correlation. And so this is Jeremy's baby. He's already submitted his research with the Harvard School of Public Health. So that's pending publication. But essentially, the big difference is that traditional models of natural language processing using either recurrent or convolutional neural networks, it's unidirectional. What have you been typing in the past? I try to assess what's next. But the latest AI technology, in particular for us, it's using BERT, or bidirectional encoder representations of transformers, meaning I look at both what have you talked in the past and the conversations ahead to be a lot more robust in terms of understanding context. Because the biggest challenge with language and AI is people can sometimes use sarcasm, humor, like, oh, life is unfair, life is not worth living, but actually I'm just kidding, right? And so it's very important to understand nuance and context rather than just individual phrases.